so good evening to all of you. Ask your colleague to join the class. So we are going to discuss about poliomyelitis today. We are going through various communicable disease, among which poliomyelitis is infection which affects GIT, which is causing paralysis. So first of all, epidemiology of poliomyelitis. It is an acute viral infection. It is caused by viral infection, right? Caused by RNA virus. And it is primarily an infection of alimentary tract. So it is of GIT, right? But it can cause paralysis also. May spread to the CNS. Primarily it is infection of alimentary tract, but it may spread to CNS in very small percentage of the cases. So it may cause infection of the GIT, but of CNS in very small percentage of the cases, resulting in varying degree of the paralysis. So this paralysis happens in very small percentage of the cases, right? And possibly death. But as you know that poliomyelitis has been eliminated from India because of the vaccination program. As you know that intensified pulse polio immunization program. So it has eliminated poliomyelitis from our country. Okay, so history of poliomyelitis in short I will discuss. It is first said to have occurred at the time of the ancient Egyptian. In 1789, first known description of the polio was by Underwood. In 1834, first epidemic of polio was noted in island of this Helena. 1855, first description of the pathological process involved by polio by the scientist called Duchenne. Then in 1908, transmission of the polio to monkey by Landsteiner. No need to remember all this history. Just enjoy this history. 1949, growth of the virus by tissue culture. In 1951, three types of the polio. As you know, that polio virus 1, 2, and 3. Three types of the polio virus are there. These have been isolated and identified. In 1954, first large-scale trial of the vaccine, that is SAC vaccine, was by injection. In 1958, first use of the Sabin vaccine. So there are two types of the vaccine, SAC vaccine and Sabin vaccine, right? So orally the vaccine which is given is called Sabin vaccine and injectable is SAC vaccine. So in world, with the implementation of the eradication strategy, polio has been eradicated from almost all the region of the America, Western Pacific region and Europe. See, these are the WHO region. This is not about specific of the country. America, Western Pacific region, and this Europe region. Our country falls in Southeast Asian region. So polio has been eradicated from almost all the part of the world except 2 or 3 countries, this Pakistan, Afghanistan, and Nigeria. Only in the regions of Southeast Asia, Eastern Mediterranean, and Africa, the cases are reporting, and now only in Southeast Asian region, right? This is being reported from mostly from Pakistan and Afghanistan. Very few number of the cases are being there in Pakistan and Afghanistan. So these are number of cases detected in US. No need to go into the detail. So in India, in Southeast Asia, India is only country that was old, right? So only Pakistan and Afghanistan, they are reporting the cases. So no need to go through this history because we have already eliminated poliomyelitis from our country. So agent for poliomyelitis is poliovirus, which belongs to the family Picornavirus. Right? This virion is a single RNA virus consisting of 4 aryl RNA. No need to remember this. Just remember the name of the virus, that is poliovirus. It is a belonging to family Picornavirus. Right? There are 3 types of the virus: type 1, 2, and 3. 3 types of poliovirus. Right? So this is picture of poliovirus. You can see that it is similar to corona. Right? Reservoir of infection. Main is only reservoir of source of infection. Right? Most of the infection are subclinical, so it can be transmitted from one man to another man. It is mild and subclinical case that play dominant role in spread of the infection, such like in corona. That mild cases, subclinical cases, which are not detected, they can spread the infection. Infective material is virus. It is found in feces. So virus is found in feces and oropharyngeal secretion of the infected person. So if any person comes in contact with the feces or oropharyngeal secretion of the person who is suffering from polio, then virus can be transmitted to that healthy person also. The half-life of the virus is 48 hours in sewage. Sewage is what? That is drainage water, drain water, which has been already used. Gutter no pani, right? That is sewage. So it is found in sewage as well as spread. It can spread infection through this half-life, this period, 48 hours. If virus is excreted in feces and this feces goes to the sewage, then virus can be having the half-life of 48 hours. If any person comes into this contact of the sewage, then infection can be there to that person. Host factor age, polio is mostly a disease of infancy and childhood. So you know that vaccine is given in 0 to 5 year age group, right? So most vulnerable age group is between 6 months to 3 years. So children are most commonly affected by polio virus, right? So polio disease. Okay. It has been noted in the ratio of 3 male to 1 female. So it is more common in male, right? Immunity following infection is fairly solid, although reinfection can also occur since infection with one type does not protect the completely against two other types. As you know that there are 3 types of the virus, polio virus, polio 1, 2 and 3. If infection with the polio virus 1 is there, then immunity is built up only against the polio virus 1. So still there are chances of the infection by polio virus 2 and 3, right? But we don't have to worry because of the vaccination program from India. Polio disease has been already eliminated. Inoculation and operation. Inoculation acts as a local source of the irritation, and there is no doubt that certain types of the inoculation tend to precipitate paralysis. Inoculation means it is putting the viral material which is containing viral over the skin, right? Effect of exercise. There is some evidence that if patient exercise violently during the minor illness, it may develop paralysis during the major illness. So if any person is having poliovirus infection in its alimentary tract, in the GIT, and if that person is doing regularly exercise and violent exercise, vigorous exercise, then that can result in paralysis also if you have viral poliovirus infection in your body. Host factor, pregnancy. Pregnant women seem to be liable to paralytic polio. So in pregnancy, there are chances that paralytic polio can occur. As you know that paralysis can occur only in small percentage of the persons, but there are chances during pregnancy that it can occur due to some endocrine factor. Infection in the first trimester may be associated with the fetal death. If infection of the poliovirus is there in first trimester during first 3 months, it can lead to fetal death, right? Risk factors, fatigue, trauma, intramuscular injection. So those persons who are having vigorous exercise, as we already said, and fatigue due to any other cause, trauma, right, or intramuscular injection, operative procedures such as tonsillectomy during the epidemic of the polio, or administration of the immunizing agent like aluminum containing DPT, then those persons are having the more risk of developing paralytic polio. These persons are having the more risk of paralytic polio. Environmental factor, it is more likely to occur during rainy season, right? Environmental source of infection are contaminated water, food and place. So this contaminated water is more present during the rainy season. So there are more chances of the poliovirus infection to occur during rainy season, right? Poliovirus survive for longer period of time in cold environment, right? Overcrowding, poor sanitation, all provide opportunity for the source of infection. See, these are the factors: overcrowding, poor sanitation. These are the common factors which are there for all the communicable disease, not only for poliovirus infection, but for all the communicable disease. These factors play an important role in transmission of the infection. Period of communicability for the cases, most infection are 7 to 10 days. So it can be communicable for 7 to 10 days before and after onset of the symptoms. So if the symptoms develop today, then it is communicable 7 days before and 7 days after. Actually 7 to 10 days before and 7 to 10 days after the development of the symptom. In feces, 1 to 3 weeks. If any person is having the vaccination, as you know that it is primarily the infection of GIT. So it is excreted in feces for 2 to 3 weeks, sometimes as long as 3 to 4 months. And if this feces is the potential source of infection. Mode of transmission is fecal-oral route. Remember this name, fecal-oral route. This is the main route of transmission of the polio virus. Right? Infection may spread directly through the contaminated finger where hygiene is poor, or indirectly through contaminated water, milk, food, fleas, and article of daily use. Droplet infection occur in acute stage where the virus is in throat. Droplet infection, as in case of the corona also, droplet. If anybody coughs over any, or suppose over the laptop, and if I touch over my laptop, and this is called the droplet. Whatever the cough droplets are there over the laptop or the table, then if anybody have the contact of this droplet, it is the fingers are contaminated and fingers goes to the mouth, and then this infection is transmitted. Incubation period is 7 to 14 days, right? Range is 3 to 35 days, but just you remember 7 to 14 days is incubation period. So that is about epidemiology. Just that this first part of the presentation is over, not whole lecture. Okay, I have to share another presentation. So meanwhile, you write down whatever the factors you have learned about this epidemiology of poliovirus infection. Write down in chat box. Meanwhile, I share the another feature. What are the host factor, environmental factor that we have discussed in this epidemiology? It is common to which age group, during which season it can occur. Write down in chat box. Meanwhile, I share another presentation of this polio about clinical feature and prevention. What is common age group of poliovirus infection? Write down in chat box. Which is the season during which it is more common? Write down in chat box. No one has written. What is the common age group for poliovirus infection? Which is the season during which it is more likely to occur? Write your answer. I am waiting for your reply. So clinical features of polio infection. So virus multiply in epithelial cells of the alimentary canal, lymphatic tissue, lymph node, and bloodstream. Right. So this is minor or where this primary viremia. Then multiplies to reticuloendothelial cell and bloodstream. Right. That is called major secondary viremia. Direct neural transmission through tonsillectomy. Right. In CNS, it's multiply in neurons. So first of all, infection of the alimentary canal, then reticuloendothelial system. In CNS, it can multiply in neurons to destroy them. Lesions are mostly in anterior horn cell of the spinal cord, causing flaccid paralysis. Right? Posterior and this internal column may be also involved. Right? So CNS is involved, and there are lesions. It may lead to the flaccid paralysis. In some cases, encephalitis may also occur involving brainstem, motor and premotor area. Let me check whether you have answered or not. So rainy season, yes, only 2 students have answered, it seems. And 6 months to 3 years is common. Okay, fine. Others are not paying attention. What is happening? polio under 5 years age group. So there are in clinical feature, first of all, inapparent infection. Inapparent infection means without symptom. There are no presenting symptom like in corona. 70-80% in patient may not be having the symptoms, right? So it occurs in 95 inapparent infection, that is without symptom in 95% of the cases, right? There are no presenting symptom, but in secretions in feces, virus can be isolated. Minor illness occurs to the stage of the viremia, that is characterized by lassitude, tiredness, wearingness, mopping, fever. Yes, generally, this word's been uneasiness. Whatever we feel during viral infection, uneasiness, right? Fever for 1 to 2 days with sore throat, upper respiratory infection, headache, but this all clear within 2 to 3 days. Major illness has two stages: pre-paralytic polio and paralytic polio. So clinical picture again I repeat: inapparent infection, minor illness, right? Minor illness, then major illness, pre-paralytic polio and paralytic polio. So in pre-paralytic polio symptoms, these are meningitis, whatever. Because of this meningitis, there can be headache, fever, malaise, and vomiting, pain and spasm of the limbs, neck rigidity, right? And there are some of the signs like tripod sign, kiss the knee test, head drop sign. These are useful for diagnosing the pre-paralytic stage of the polio. Paralytic stage, it is characterized by spinal form, paralysis of the spinal muscle occurs suddenly, manifest as the muscle spasm, tremor, hyperesthesia, diminished deep tendon reflex followed by flaccid paralysis. So in very few percentage of the cases, this paralytic stage occurs, and this paralysis is flaccid paralysis. Distribution of the paralyzed muscle is asymmetrical. It is not so that both the sides muscles are paralyzed. Asymmetrical distribution of the paralysis. Paralysis of the diaphragm muscle can lead to respiratory difficulty. As you know, the diaphragm is also a muscle. If it is paralyzed, then patient is not able to properly perform the respiratory activity. Transitory urinary retention and constipation due to autonomic involvement. Right? Bulbar and bulbospinal form less than 10% of the paralytic polio. There can be paralysis of the vagus. It can lead to the weakness of the soft palate, pharynx, and vocal cord. Breathing and swallowing become difficult. Paralysis of the respiratory center can lead to shallow respiration, irregular respiration. If the vasomotor center in brain area is affected, it can cause change in pulse and blood pressure. Skin is dusky. Anxious, may become confused, delirious, and comatose. I think now you are all, you can all see this slide. So this is the slide showing muscle which are commonly weakened by polio: shoulder muscle, muscle behind the arm, back muscles, thumb muscles, and there can be contracture causing the tight cord, muscle that can straighten the knee, muscle that lift the foot, muscle that straighten or bend the hip. These are all commonly weakened. Differential diagnosis means the similar feature can be observed in aseptic meningitis, infective polyneuritis, or GB syndrome. Commonly, this is GB syndrome. This is particularly used for differential diagnosis. Laboratory diagnosis of poliomyelitis. Now, is it visible to all of you and audible? Laboratory diagnosis of poliomyelitis: virus can be isolated from blood or CSF or throat swab or feces. So these are the samples which are used for laboratory diagnosis. Specimen which are inoculated into tissue culture, this is not commonly used. That's so no need to go into details. Serodiagnosis, that is also less often used. So only mainstay of the diagnosis, clinical feature as well as viral isolation. Prognosis outcome may vary from with the form and site affected, which is the form of the disease and which is the site. Spinal cord and brain, if affected, then if not affected, then complete recovery is possible. So if there is no affection of the primer cord, as spinal cord as well as brain, then complete recovery is possible. Brain and spinal cord involvement is medical emergency. Complication of the polio: spread of infection to non-immunized children, but this is not nowadays a problem because all the children are immune by polio vaccine. It is given at birth as well as at 1.5 months, 2.5 months, and 3.5 months, as well as booster dose are also given between 16 to 24 months. The another complication: permanent muscle paralysis, pulmonary edema, and shock. Complication of immobility and respiratory involvement. As you know that there is paralysis, so child may be immobile, right? Respiratory involvement, aspiration pneumonia because of the involvement of the muscles of the this pharynx. Right? Other complication: high blood pressure, UTI, kidney stone, paralytic ileus, myocarditis, cor pulmonale, that can occur in few percentage of the children. Treatment: so if the child is having polio, so what is goal of treatment is to control the symptom while infection run its course. So life-saving measure can be particularly assisted whenever there is breathing difficulty, rest in bed, relief of the pain, and neutral positioning of the limbs, right? And physiotherapy. These are the mainstay of the treatment of the polio. Rehabilitation of the patient, like as you know that there is paralysis. So you may have seen the older children or older person before the elimination of the poliomyelitis in India. So the older person who are already having the poliomyelitis, so rehabilitation with the help of the caliper or the sticks, right? So that is given so that they can walk easily. Other rehabilitation measure in form of the physiotherapy, braces, right? corrective shoes. So the shoes which are having the shape which can neutralize the paralysis. Right? Orthopedic surgery may be also necessary to maximize the recovery. So in older children, before the elimination, who have already developed the poliomyelitis, right? So in that also orthopedic surgeries are being carried out to correct the paralysis. Post polio syndrome, it is the condition which affect if the polio survivor leads to 10 to 40 years after the initial effect. It is characterized by the weakening of the muscle previously affected. Symptoms of this post polio syndrome is fatigue, progressive muscle weakness, muscle atrophy, joint pain, and skeletal deformity like scoliosis. So we are not going into the post polio syndrome, right? And we are strictly going now for prevention. In prevention part, as you know, that polio vaccine. This is photograph of the post polio syndrome. Polio vaccine. It is it is dramatically to polio virus infection elimination, right? From almost all the country except two countries from of the world. And this polio vaccine, you need to remember that this is given as OPV, oral polio vaccine, right? OPV. And dose of this polio vaccine, it is 2 drops. As you know that during our uh, intensified pulse polio immunization program also, 2 doses of polio vaccine are given. 2 drops of the polio vaccine are given for prevention. And in routine immunization, this vaccine is started soon after the birth. So at birth, first dose, that is called 0 dose. OPV 0 dose is given. Then the dose of the vaccine, it is given at 6 week, 10 week, and 14 week. Or we can say 1.5 month, 2.5 month, and 3.5 month of the age. Then at the 9 month of the age, then at 16 to 24 month of the age, this vaccine is given. So immunization, it is the mainstay of the prevention of the polio vaccine. I mean to say polio disease, right? And currently we are eagerly waiting for vaccine of corona, right? So vaccines are important way for prevention of the disease which are communicable. So immunization can be active or passive. Active immunization with the help of the vaccine, single vaccine, that is OPV, oral polio vaccine, that is given by oral route, or IPV, and multiple, that is improved IPV, right? So apart from the OPV, this IPV vaccine is also given. Passive immunization by human immunoglobulin, which is not currently employed, right? Only with the help of the vaccine, we have eliminated this poliomyelitis from India, and health education, of course. Right? So this inactivated or SARC vaccine and this killed vaccine, 3 doses are given at the interval of 1 month, not 1 to 2 months, 1 month starting at 6 weeks. OPV 0 is given at birth. Then after this 6 week, 10 week, and 14 week. Just remember that. No need to go into other detail. So that is polio vaccine. I'm not going into the other details. Right? Just remember the dose. Again, I repeat. This dose is OPV 0 at birth, OPV 1, 2, and 3 at 6 week, 10 week, 14 week. OPV booster dose at 16 to 24 month of the age, between 16 to 24 month of the age. And apart from the OPV, IPV is also given, right? I'm highlighting which is currently being practiced along with the OPV. IPV is given, but IPV is given as the fractional IPV, that is called as FIPV, right? FIPV. And FIPV is given only 2 doses, that is at 6 week and 14 week. Again, I repeat, FIPV only 2 doses, that is 6 week and 14 week. It is injectable. It is given intradermal vaccine, FIPV at 6 week and 14 week. Right? Write down what you have understood about IPV and OPV doses. Write down in chat box. What is dose of OPV vaccine? When it is given, write down in chat box. When OPV vaccine is given, write down in chat box. OPV 0, 2 drops. Okay, then 6 week, 10 week, 14 week. Very good. Okay, Neil has replied. When IPV is given, IPV 2 dose at 6 week and 14 week. What is root of IPV? IPV root. What is the root of IPV vaccine? Meanwhile, I tell you about this herd immunity. We are hearing about this word in Corona also, herd immunity. Herd immunity means what? Just have the clear concept about this. If in 100 patient, 100 persons, if there are 100 persons, if about 70 to 80 persons are protected by vaccine, 70 to 80 are immunized by vaccine, right? So rest of the 20 who are unimmunized, they are also being protected because majority of them have taken the vaccine. So in 20 remaining 20 persons, right, 20 persons, there are less chance that the disease will develop because the virus will find almost all the persons who are immune, right? So virus will not find the way of any persons who is unimmune and that can develop the infection. So because 70 to 80 persons are infected, because 70 to 80 persons are protected by the vaccine, other 20 are also being protected because of this. This is called the concept of herd immunity, right? So I draw over here. Suppose there are the persons, right? Majority. This is community in which this round is what? These are the persons who have taken vaccine. These are the persons who have taken vaccine, right? So majority, you can see that majority of the persons have taken vaccine. So the virus goes from one person to another person. This is also immune. From this to this is also immune. From this to here, this is also immune. Meanwhile, virus dies. No, virus cannot survive. So because all these persons are protected by vaccine, these two persons, right? Two persons who have not taken vaccine, these are also being protected. This is called herd immunity, right? I think you understood this concept of herd immunity. Yes, intradermal is the route for in this IPV, right? Have you understood this concept of herd immunity? So development of the immunity, vaccine administration. When we administered vaccine, we are giving virus, right? Live virus and as well as killed virus, right? So administration of the vaccine can lead to the minor infection without any symptom, right? And it can produce the immunity inside the GIT, right? And whenever there is a real infection, then you know that there are memory cells, memory T cells in our immune system that can remember this infection, and whenever there is a real infection, it can fight against the virus. So no other details are required. Just remember the dose of polio vaccine, right? The vaccine, all the vaccines are stored in ILR, that is Iceland refrigerator, between 2 to 8 degree centigrade in PLC. This is vaccine carrier into which vaccines, you may have seen this vaccine carrier in a polio booth also, into which oral polio vaccine as well as other vaccines, all the vaccines are being carried out in Mamta sessions, and it is which is used for immunization in field. So that was about this pulse polio immunization, and already I have told you actually IPPI, that is intensified pulse polio immunization, in which there is first day booth activity, in which polio booth you used to take the vaccine in polio booth. You may remember that, right? So in first day on polio booth, 0 to 5 year children are being immunized by giving OPV drops, 2 drops of the polio. And on subsequent 3 days, house to house activity, in which remaining children who may have not taken the vaccine, they are being immunized. That is intensified pulse polio immunization program, and through which polio has been eliminated from India. This is again the OPV vial. You can see that there are circle in middle. There is white circle, and this is surrounded by this blue circle. This is called vaccine vial monitor. You may read over here VVM. That is what vaccine vial monitor. So that indicates that this vaccine is proper or not. There should be white color inside and blue color outside. Whenever this vaccine is kept outside and it comes into the environmental temperature, as you know that vaccine should be stored between 2 to 8 degrees centigrade. Once the vaccine is vaccine is exposed to the more temperature, more than 8-degree temperature, then this white color it start to turn blue slowly, right? Whenever this white color is having the similar as the blue color, like I am drawing over here, if this white color it turns to similar, it is not exactly similar, right? So it turns to the similar of the outside or more darker, then this vaccine is no longer usable. So in this stage, vaccine is no longer usable. So that is the indicator. Suppose darker, whenever this turns darker, this white color turns darker, vaccine will not be usable. So that is called vaccine vial monitor. This vaccine vial monitor is given over each vaccine vial. That indicates that the temperature is between 2 to 8 degrees. Remember what should be there? The square should be white, right? Inner square should be white. Whenever it slowly turns darker, then vaccine will not be used. Once the OPE vial is opened and filled, it should be used within 4 hours, right? So that is all about poliomyelitis disease, right? Any questions regarding this polio infection, poliomyelitis? Write down your roll number and then we will end this class. Write down your roll number in chat box and then leave the class. Okay, write your roll number only once. No need to write down 2-3 times. Okay, I think all of you have written your roll number. Thank you very much.